So you're getting cataract surgery. Congratulations, you're on your way to clear vision. Cataract surgery is very quick, precise, and customizable. Now, the main goal of cataract surgery is to get you seeing better, and that makes sense. But over the years and advancement in technology, a lot of patients expect not only to see better, but they want to reduce their dependency on glasses. Now, remember, the human eye has a natural human lens, and that becomes cloudy, and that is termed a cataract. So cataract surgery is the extraction of that lens, but we need to put a man-made lens inside. So let's talk about your lens options. Basic intraocular lens. And don't get me wrong, there's nothing basic about this lens. It is a high quality optic that produces very good vision, but it has some limitations. It cannot correct astigmatism, and it's not a multifocal. So choosing this intraocular lens, there's a higher % chance that you'll require some degree of glasses at the distance as well as for up close. Now, this surgery or this implant is also typically covered by medical insurances. Now, these next options I'm going to discuss are not covered by your medical insurance. Your insurance will still cover the surgery, you would just pay out of pocket for the intraocular lens. Light adjustable lenses, or LAL. These are a really cool technology, and much like they sound, we can actually adjust the power of the implant when you're done healing. This is a way that once the eye is completely healed, we can use a UV light to change the prescription lens and really customize it to that patient's prescription. Now, a person that would be a great candidate for this is someone that had previous refractive surgery like RK surgery, or has an irregular cornea where we cannot obtain 100% accurate preoperative measurements. So this is a way of putting an implant in the eye, getting you close, and then we can fine-tune the vision afterwards. Now, the one thing to think about with this intraocular lens is there is a lot more time. There are a lot more follow-ups involved because once you're stable, we can adjust the implant up to 3 times, and then we have to lock in the implant. Also, during the post-operative period, you have to wear UV blocking glasses because the UV light from the sun can change the power of the lens and alter your prescription. And once you're done, locked in, you don't have to worry about those UV blocking glasses any longer. Toric intraocular lenses. If you've ever been diagnosed with astigmatism, this may be a great fit for you. And if you don't know what astigmatism is, that's when your cornea is more so shaped like a football than a basketball, and it allows for an uneven focal point within the eye. Toric lenses are especially designed to get that focal point to be equal and land on the retina, giving you clear vision. But a straight toric does not have a multifocal, so if we target full distance visual acuity, you still will need to put on a pair of reading glasses. Sometimes with this lens, we will do monovision, where we take your dominant eye, we set that at the distance, your non-dominant eye, we set it for up close, and we get a blend of vision. Still not a guarantee you're not going to wear glasses, but we can reduce your dependency on glasses. The Odyssey intraocular lens. Now, this is the new kid on the block in the cataract surgical world. This lens is designed to give you a wider range of vision, trying to give you a focal point at the distance, intermediate, and up close. Really trying to reduce your dependency on glasses at all ranges. This lens is also offered in a toric version, so if you have astigmatism, this is still a potential option. Now, if you're diagnosed with like macular degeneration or bad corneal pathology, this is probably not the best lens implant for you. It's not going to deliver the optics that you want. One other thing to think about when you're dealing with multifocal implants is the lens design has concentric rings. And when you look at a light, you potentially can notice rings or halos around the light. The Odyssey design is to try to minimize those halos and glare at nighttime driving, but there is still a potential chance of having halos around lights. LensX. This is not an intraocular lens. This is a laser-assisted surgery. The laser can help the surgeon make the incisions, perform what's called a capsulorhexis, that's opening the bag where the cataract is housed, and it also can break down the cataract and almost liquefy it, all before the surgeon ever enters the patient's eye. We tend to see less swelling, less inflammation when we utilize the LensX laser. The laser can also reshape the cornea, and it's actually really good for correcting small amounts of astigmatism. Now, LensX can be standalone and used with any intraocular lens. It can be combined with multifocals, toric, as well as the basic intraocular lens. Now, the one thing that you want to remember is it doesn't matter which intraocular lens or which technology we use to take out the cataract. We can never predict how the eyeball is going to heal, meaning how much scar tissue, how does the incision do. And there is no guarantee that you're not going to wear glasses afterwards. I will tell you, we are really accurate with all of these preoperative measurements, and we can hit our mark really close the majority of the time. So sometimes a patient can have 1 or 2 steps of prescription left over. But I will tell you, with these technologies and all the equipment we have to measure the eye, we can get pretty darn close majority of the time. So just remember that cataract surgery is not a one-size-fits-all. Have a conversation with your eye surgeon, go over your hobbies, your vision goals, and you can customize a plan to fit your lifestyle.